The topic of mental health is on the table as talks on the state budget continue in Harrisburg. Fox 43's Marshall Keeley explains how much money the governor wants and why one organization believes it is not nearly enough to tackle the problem.
Mental health care is top of mind in the Commonwealth this month. It's an issue Lisa Schaeffer from the County Commissioners Association of Pennsylvania says has been underfunded for more than a decade.
The mental health system in Pennsylvania really is crumbling.
Substance abuse disorders, child abuse, domestic issues all stem from mental health.
Republican Representative Jim Struzzi is co-chair of the Pennsylvania House Mental Health Caucus. He works alongside Democratic co-chair Representative Michael Schlossberg, who knows the value of mental health treatment personally.
I see a therapist on a regular basis. I've been suicidal, and I know just how bad that darkness can be.
Schlossberg says there aren't enough places to find that treatment in Pennsylvania or enough professionals to provide it.
Biggest crisis in mental health, bar none, is lack of people who are in this field, because you can know you need help, have the insurance to cover that assistance, or have the cash to do it, and if there's nobody to answer the phone, it's all kind of irrelevant.
Schaeffer says it's leading to lengthy wait times, some patients telling her they couldn't get an appointment for 6 months. Last year's budget included an additional $20 million for county mental health funding, and the Shapiro administration proposed another $20 million increase for this year. But Schaeffer says it won't be enough to cover the gap.
We've seen rising costs, the same as everybody else, in our workforce and our operational costs, and that $20 million will generally help us to keep things status quo. While appreciated, it's really just a drop in the bucket to addressing the need that we are seeing out there in Pennsylvania.
That's why the County Commissioners Association is asking the state for a $250 million increase to help improve services. It would be funneled through the state's funding formula and split amongst Pennsylvania's 67 counties.
I think it's a realistic number. I have asked the County Commissioners Association to show us how that money would be used.
Schlossberg seemed to doubt the $250 million could come in a single year, saying it will take time to boost the state's system.
In order to address it, we need to build a political will to say, you know what, I want to spend money in that area. I don't care what it takes.
It's not just funding. Lawmakers say the state needs to reassess its mental health system and work with providers to get Pennsylvanians the care they need.
It is a problem that we need to take a big picture, long-term view of.
We need to invest dollars to create more programs, more beds, and more access to care.
Mental health really makes our community safer, and it gives people opportunity. It helps get people back into the workforce, and so I think that's something that we can all agree on.
Marshall Keeley, Fox 43 News.
And Fox 43 continues to highlight the importance of May's Mental Health Awareness Month. Our 4th annual special program, Silence the Stigma, the mental health funding crisis, will air on Wednesday, May 15th. We'll dig into how mental health advocates say more than a decade of funding issues is drastically impacting community services. That is 6 p.m. May 15th here on Fox 43.